All right, so today we're really diving deep into something pretty specific.
Oh, yeah.
We're looking at the Ghana Standard Treatment Guidelines.
Okay.
And more specifically, we're going to be focusing on STI-related inguinal bubos.
Interesting.
We've got excerpts here from the 7th edition, which was published in 2017.
Okay.
And I think our goal here should be to try and figure out what these guidelines tell us about what causes these bubos, what to look for, and how healthcare providers in Ghana are approaching treatment for them.
Makes sense.
I think that's something that's really relevant to a lot of our listeners.
Oh, for sure.
Because it gives us a really good window into how medical knowledge actually gets translated into actual practice.
Totally into these like standardized steps to like manage a specific health issue.
Right.
It's fascinating.
So right off the bat, these guidelines pinpoint two main culprits for these STI-related inguinal bubos.
Right.
We've got chlamydia trachomatis, specifically the lymphogranuloma venereum type, or LGV.
LGV.
And then Haemophilus ducreyi, which is the one that causes chancroid.
Yeah, so right away we're dealing with bacterial infections here.
Exactly. So that's like a really important foundation to keep in mind.
Definitely, it is. And it really helps us to understand why they chose the treatment options that they did.
Now, if you were to actually have one of these, what are some of the things that you might notice?
Right.
The main symptom that they talk about is swelling in the groin area.
Okay.
The inguinal region.
So it's pretty straightforward.
Yeah, pretty straightforward. But interestingly enough, this swelling can either be painful or completely painless.
Really?
And that difference in pain levels is a really crucial detail for any healthcare provider to consider.
Yeah, because I'm sure that helps them determine exactly what's going on there.
Absolutely. And it really shows how important a careful examination is.
Right.
So in addition to the pain, what are some of the other things that a healthcare provider might observe?
Yeah, what would they be looking for visually?
Well, these swellings in the groin can show up on just one side.
Okay.
Unilateral. Or on both sides, which would be bilateral.
Bilateral, all right. So, different presentations there.
Right. And they can also be tender to the touch or not.
Interesting.
They can feel fluctuant, like they're full of fluid.
Oh, okay.
And the guidelines even mention that they could start discharging pus.
Oh, wow.
That's called suppurating.
Suppurating, okay.
And they even mention that a genital ulcer might also be present.
Oh, wow. So that's a lot of different signs to look for.
Yeah, it is. And it's important for the healthcare provider to really pay attention to both the presence and the absence of these things.
Totally, because it helps them, really get a complete picture.
It really guides their diagnosis.
Exactly.
Now, here's where I think it gets really interesting.
Okay.
These guidelines strongly recommend using what's called a syndromic approach.
Okay, I've heard of this before.
So what this means is that instead of necessarily waiting for lab results, the treatment decisions are primarily based on recognizing a consistent pattern of these symptoms and signs.
Okay, I see.
In fact, the guidelines specifically say no investigations required in view of this syndromic approach.
Interesting.
For those like initial steps.
So that's pretty significant because that means that the healthcare providers in Ghana are making their decisions based on what they see and what they hear from the patient.
Exactly.
Rather than lab tests.
And they're not waiting for those potentially time-consuming and possibly unavailable lab results.
That makes a lot of sense in an environment where resources might be limited.
It's a really practical approach.
It is.
But it definitely raises some questions.
Oh, yeah, of course.
About how accurate that diagnosis is going to be.
Especially on a case-by-case basis.
Right.
It's really interesting, though, that they prioritize that timely treatment based on what they're seeing.
So once they make the diagnosis, what's the main goal of the treatment?
Yeah, what are they hoping to accomplish?
Well, the most obvious goals are to relieve the pain.
Okay.
And to reduce the swelling.
Makes sense.
But just as importantly, they want to try and treat those underlying infections, both the LGV and the chancroid.
Gotcha. Treat them at the same time.
At the same time.
Okay. So it's a very comprehensive approach.
It is.
Addressing both the immediate symptoms and the root cause of those symptoms.
Right.
Very thorough.
So when it comes to treatments that don't involve medication.
Okay. So non-pharmacological.
Exactly. The guidelines recommend aspirating those fluctuant buboes.
Okay, so that's where they use the needle to drain the fluid.
Exactly, and they want you to do that every 2 to 3 days.
Okay.
And it's super important that you go through healthy skin.
Yeah.
And they really emphasize that you should never cut into the swelling.
Okay.
You should never do incision and drainage.
So why is that?
I think it's because there's a higher risk of complications or delayed healing.
That makes sense.
They also say that if the buboes just won't go away, then you need to refer the patient.
Okay.
And they also point out that there could be some long-term problems down the line, like strictures or fistulas.
Oh, wow.
That might need surgery.
So these things can become pretty serious.
They can, and I think that really underlines just how critical it is to provide the right care right from the beginning.
Absolutely, get it right the first time.
Okay, so now let's switch gears a bit.
Okay.
And talk about the drug treatments.
All right, so the pharmacological side of things.
Exactly. And one thing you might notice is that the evidence rating for these is C.
A C, okay.
Which basically means that these recommendations are probably based on expert opinion, or maybe on some limited clinical studies.
So it's not quite as solid evidence as some of the other stuff.
It's something really important to remember. So for tackling both the LGV and the chancroid at the same time, they recommend 3 main oral antibiotics.
Okay, let's hear.
First up, we've got doxycycline.
Okay.
100 milligrams every 12 hours for 21 days.
Got it.
Then there's azithromycin, which is just a single 1 gram dose.
Just one and done.
Yep. And then lastly, there's erythromycin. 500 milligrams every 6 hours for 14 days.
Okay, so they've got a few different options there.
They do, and I think that gives the healthcare providers some flexibility.
Right, depending on what's available or, what the specific patient might need.
Right.
Makes sense.
So just to kind of sum everything up.
Okay.
These STI-related inguinal buboes, they're mainly caused by very specific bacteria.
Right.
And they can show up with different pain levels and all sorts of physical signs. The approach that they take in the Ghana guidelines really relies on pattern recognition.
That syndromic approach.
Yeah, that's what it's called.
Which means that you don't necessarily need those immediate lab tests.
Right.
Interesting.
And then treatment involves draining the fluid with a needle if necessary, but absolutely no cutting.
Right, no incision and drainage.
And then they use specific antibiotics to target both infections at the same time.
Very cool, very cool.
I think one of the biggest takeaways here is that recommendation against incision and drainage.
Yeah, that seems really important.
It really highlights their preference for that less invasive initial strategy.
It does.
So I think to wrap things up, I'd like to leave our listeners with something to think about.
Brining thought.
Yeah.
I like it.
Considering these really detailed treatment guidelines and that focus on this syndromic approach, what do you think some of the advantages and disadvantages of that approach would be?
Ooh, that's a good one.
Especially in different healthcare settings around the world.
Yeah, that's something to really ponder.
I think it really gets at the heart of balancing practical needs with ideal diagnostic practices.
Totally. It makes you wonder, how standardized care is adapted to different contexts.
Right.
And all the trade-offs that come with that.
Exactly.
Great episode.
Thanks.
Yeah, this was really interesting.
I learned a lot.
Me too.
All right, thanks for joining us.
Anytime.
And we'll catch you all next time on The Deep Dive. Later. Bye.